Hello, I'm Shelley Fold-Nasso, CEO of the National Coalition for Cancer Survivorship. Thank you for joining us today as we share the results of the 2021 State of Cancer Survivorship Survey. This marks our third year conducting the survey, and we are grateful to Bristol-Myers Squibb for their support. Each year, we build on what we learned in the previous survey to identify trends and delve deeper on specific topics. We start with in-depth interviews with cancer survivors to help us shape the questions. We use a national sample that reflects the population of cancer survivors in the country, and we contrast the results of the national sample with respondents who are connected to NCCS. We have found interesting differences in how average cancer patients approach decision-making and consider the quality of their care compared with patients connected to NCCS. This year, we wanted to understand disparities in the quality of care as assessed by different demographic groups. We also asked about the physical, emotional, and financial costs of cancer, as well as about support systems that help patients and survivors throughout their journey. We wanted to understand how the COVID-19 pandemic affected cancer care and patients' perception of telehealth appointments. And finally, we asked about the meaning of survivorship and to what degree respondents identify with the word survivor. Edge Research has been an incredible partner with us working on this survey over the past 3 years. I'm grateful to have Pam Loeb, principal at Edge Research, here to walk us through the results. Before I turn it over to Pam, I want to thank the entire team at Edge and NCCS who helped us develop the survey, promote it, analyze the results, and create the report and infographics that tell the story of what we learned. It was a huge team effort. So now I'm pleased to turn it over to Pam.
Thanks so much, Shelley. Really appreciate it. Shelley's already done a great job of covering the first couple of slides that I have. As she mentioned, this has been our third year conducting what we're calling the annual State of Survivorship Study, where we delve into the patient and survivor journey, and we look at it from a range of different perspectives, all to help this organization and all of you support the advocacy work that you're doing for quality cancer care for all. Shelley already talked a little bit about the methodology. Let me just go into a little bit more detail. So every year we've started the study off with a qualitative phase where we sit down, and this time it was virtual, with cancer patients and survivors and have some open-ended conversations where we talk about their journey over time. This year, we focus specifically on metastatic patients and patients from a low income, not college educated, to really understand what specific challenges and hurdles they might face so that we could make some adjustments to the survey that we've been fielding over the last few years. We followed that up with 2 parallel surveys. One survey, which we'll, as we go through this report, we'll call the national sample. So this was a nationwide survey of adult cancer patients and survivors. 1,100 people participated. We made sure that the sample was representative of the cancer population by age, gender, race, ethnicity, and region. And we used ACS and NCI data to ensure that. And then we did a parallel survey of people who were connected to NCCS. So we'll call those the NCCS-connected sample as we go through this data set. Our national sample, all of the charts will display that data in green and NCCS-connected in orange. One other kind of visual cue as we go through this, whenever you see numbers in blue or red, it indicates statistically higher in blue, lower in red. And whenever you see up or down arrows, that represents changes from the survey that we did just a year ago. So there are 6 chapters to this study. The first looks at attitudes and values around cancer treatment and care. Shelley already talked about the fact that we also in this study really looked at health equity and disparities in care by different demographics. All of that kind of ladders up to the financial, physical, and emotional costs of cancer, which we delved into, and the people and organizations that individuals go to for support. 2020, 2021, COVID, obviously it was important to understand what treatment was like during this unprecedented period. And then we end with some findings around the meaning of survivorship. So let's start off talking about mindset. And one of the first questions that we asked people who took the survey was, when you think about your experiences as a cancer patient, which of these two statements that you see here on the left-hand side come closer to your point of view? I relied on the doctor to decide on treatment options and choose the best course of action, or I was actively involved in researching and deciding on the best treatment options for me. And we also gave people the opportunity to say they were somewhere in the middle. So on the left, you can see the results from 2020. Very clearly, majorities of people were kind of in this doctor knows best camp by a 3-to-1 margin. In 2021, and this is really the one place in the survey where we saw opinions shift dramatically. While a plurality still say that they relied on their doctor, you can see that those numbers went down significantly. Just 44% said that they relied on their doctor for treatment options, and 33% said that they were actively involved in deciding on the best treatment options for them. What we can't answer right now is why. Why this big shift? I mean, this could be kind of a one-off blip based on when we were in the field with the survey. It could represent a shift to a more informed patient population, which would be a huge win. And or it could be a response to changes in attitudes around healthcare during COVID. So this is a trend that we'll continue to watch and something that we'll want to delve into more next year. But as we move to the right-hand side of the screen, I do want to just add that there are definitely some audiences that were more involved in the decision-making process. They tend to be younger. Our Hispanic participants were more likely to say that they were active in choosing the best treatment options for them. People in urban areas, those who participated in the clinical trial. Of no surprise, those who participated have had more newer forms of therapy, immunotherapy, targeted drug therapy, palliative care, those who are still in treatment, and those with a college education. And then also those who are connected to NCCS, of no surprise. We also saw a slight increase in the number of people who said they wanted to learn more about their diagnosis and treatment options. At the same time, however, very few patients told us that they participated in a clinical trial, just 9%, or that their health team even discussed a clinical trial with them, just 11%. Again, there are some audiences who are higher for both of these. Many of the audiences that I just mentioned on the last slide, as well as those who receive their care in an academic medical center, but still very few who even say that they know about the option to participate in a clinical trial. And then kind of our last slide around mindset really was around what people's goals are as they think about their experiences as a cancer patient. And again, we gave them two statements. And you can see that most people said that their focus was on getting rid of the cancer, no matter what. 7 out of 10 said this describes them, versus focusing on maintaining quality of life as much as possible. Just 14% said this describes them. Those who are undergoing treatment right now and metastatic patients are more likely to say that they focus on maintaining quality of life, but still lean heavily towards being cancer-free. And this theme will continue throughout the report. As Shelley mentioned, we really wanted to drill down in this year's study on some of the disparities in quality of care. And one of our next questions for patients was, overall, how would you rate your satisfaction with your cancer treatment and care? And actually, Most patients say excellent, 75%, just 22% say good, only 3% say fair or poor. In a follow-up question where we ask people why this excellent score, the kind of prevailing theme was because I'm still alive to take this survey. So as you can see, and this is a quote from one of our survey respondents, I'm alive, period, kind of number one reason. There are, however, again, some pretty significant differences by demographics. So those 65 years of age and older are significantly more likely to say that their treatment and care has been excellent versus those in our youngest 18 to 39-year-old age group. There are statistically significant differences between white participants versus Black and Hispanic participants. Those who had surgery only versus those who had chemotherapy, targeted drug therapy, or immunotherapy. And then one of the things that we'll see, and this is again a theme that we'll see throughout, there is a strong correlation between how people feel about their treatment and care and the support systems they have and how informed they felt about side effects. So the more support you feel you've gotten over the course of your journey, the more informed you feel, the more likely you feel that your treatment was excellent. And then last but not least, there is a big difference based on how long it's been since your diagnosis. So I think part of this is just, people, A, kind of memory, and B, the longer you're alive, the better you feel about the treatment you received. I do want to focus, however, on some of those people who didn't say that their treatment and care was excellent. We asked a follow-up question and asked them to kind of tell us in their own words why they felt this way. And there were really three key themes that we saw in these open-ended responses. One of the themes was around income disparities. As this, kind of very honest respondent said, I rate my care as fair or poor because to be honest, I'm poor. I just went with the program and I tried not to bother anybody. Another theme that we see is just the lack of support and coordination of care from healthcare providers. As one metastatic patient said, there's been no continuity. I see a different infusion nurse every time, a different NP every time. We discuss medication or scans, they don't get ordered. Insurance companies and doctors' offices don't communicate. No one seems to know me. And then a big theme with our youngest audience was around feeling as if they just don't have a voice. As this one participant said, I don't feel that I was even consulted about options because I was young and considered not smart enough to be in charge of my own care. I felt like when I finished treatment, I was just dumped. There was very little care given to how I would have a lifetime of survivorship ahead of me. No one ever wanted to hear about complications I was having, even though some ended up being early signs of poor lifelong outcomes. So from there, we drilled down and asked people about specific providers. Two questions. The first was, which of the following providers did you see during your cancer treatment? And that's what you see with the green bars. And then a follow-up question among each of the people who said that they saw the various providers, how helpful was that provider? And the percentage who said each of the providers was very helpful is what is being indicated by the green line. So oncologists and surgeons were seen by the largest number of people, and satisfaction with these audiences was pretty strong. Almost 9 out of 10 said that each were very helpful. We had about half who said that they saw a primary care physician during their cancer treatment. Satisfaction numbers for PCPs, about 20 points lower. Then the numbers kind of drop in terms of different healthcare providers seen. I'll just point out a couple. Although we did not have a lot of people who said that they saw a nutritionist, a social worker, or even a patient navigator as part of their care, those numbers are the percentage who say that each of these providers was helpful is definitely lower than some of the other providers that we asked about. Then we drilled down on coordination because you can see among those who said that their care was fair or poor, coordination of care was definitely an issue. That said, most people in the survey rated their coordination of care between healthcare providers as, said that they did a very well or somewhat good job. But then when we went on to ask people, well, how often do you have to actually share information from one healthcare provider to another, so they're informed about your cancer care? And with that follow-up question, we saw that, majorities, 54%, said that they have to share information all of the time or some of the time. And this was higher among, again, younger patients, those going through immunotherapy, Hispanic participants, those still in treatment, and metastatic patients. We also wanted to understand a little bit more about the relationship that people feel they have with their healthcare provider. So we asked people, thinking about your cancer treatment and care, how often did you feel as if you could actually talk to your provider about any concerns you're having? And how often did you feel like they listened to your questions and concerns? Again, the vast majority did feel as if they could talk to their provider and that their concerns were respected. These numbers were lower with our NCCS-connected group. Maybe, again, one of the reasons why they have sought National Coalition of Cancer Survivorship out for advice. But there were also some key age differences, differences by ethnicity. Hispanic patients and survivors less likely to feel as if their issues were respected. And we saw also some significant gender differences. So you'll see the quote at the bottom of the page: "He dismissed me out of hand regarding my pain. I don't feel as a middle-aged woman that I'm heard." And there were a number of quotes very similar to that as we kind of read through the open-ended responses. One of the things that we've been tracking over the last 3 years that we've done this survey is symptoms or side effects experienced during treatment. And we've looked at kind of a list of about 24, 25 over the course of the work that we've been doing with NCCS. 84% of patients experienced at least one of the 24 symptoms that we looked at. On the left, you see the percentage who said that they experienced each. Feeling overly tired kind of being the symptom experienced the most, followed by sexual concerns, depression, muscle and joint pain, nausea, vomiting or diarrhea, neuropathy, and loss of appetite. If we look to the right, there again are some key demographic differences. Women, younger patients, Hispanic patients, and those in lower income groups are more likely to say that they experience any or all of these various side effects and symptoms. And then, also looking at these various symptoms, metastatic patients are more likely, of no surprise, to experience almost all of the major symptoms tested in the survey. 72% saying that they feel overly tired. Majority saying that they've experienced nausea, vomiting, or diarrhea, and about half neuropathy. I mentioned earlier that there is a strong correlation between the number of people, between how you feel about the quality of your cancer care and how informed you feel about potential side effects from treatment. So we have about 2/3 who feel informed about side effects. But when we look specifically, when we ask specifically about each of the side effects that people experience, and if their healthcare team has been very helpful in addressing those, There's really only 3 that a majority say their healthcare team was very helpful in addressing. And those tend to be symptoms where there are either drugs or guidelines to help. So nausea, vomiting, diarrhea, loss of appetite, and skin issues are the 3 things that majorities say their healthcare team has been very helpful with. Everything else, less than half. So, even though 45% say that exhaustion is one of the side effects, less than half say that their healthcare team has been helpful in helping them address that concern. Same with depression, anxiety, and muscle joint pain. Now I'm going to move from kind of in treatment to post-treatment care. And we asked a very similar question. Overall, how would you rate the post-treatment medical care you're currently receiving? You can see that the numbers drop. 75% said that their cancer treatment was excellent. Now we're dropping to just 63% who say that their post-treatment medical care is excellent. And when we look at the topics that healthcare professionals are talking to people about post-treatment, you can see in that total line that there's not a single topic that we drill down on that a majority say they talk with their healthcare provider about regularly. And if you feel as if your post-treatment care is fair or poor, those numbers drop precipitously. So all of this, kind of ladders up to what the costs of cancer are. When we say costs, I know that people often think of the financial costs, but there's obviously also the physical costs, the social and emotional costs. So we have delved into all 3 of those in this survey and in previous iterations. And we asked about actually 30 different issues that fall into one of these 3 buckets. And this year, the issues that rose to the top, which is what you see on this slide, are very similar to the results from 2020. On the physical side, maintaining a healthy weight, having the energy to make it through the day, getting enough exercise, managing side effects, and maintaining a proper diet are the areas where people have the greatest concern on the physical side. On the emotional side, it's grappling with uncertainty about the future and being there for family and friends. We have about a third who say that they are concerned about their ability to get the mental health support that they need. This year, we also asked about isolation and loneliness because it was a theme that came up in our qualitative interviews. A lot of it to do with COVID and people's concerns about going out. 33% said this was a concern. And on the financial side, we have almost half who say that they're concerned about the cost of medical care, whether it be prescriptions, non-medical expenses, or getting and keeping insurance. All of these issues are greater concerns for women, younger patients, Hispanic patients, and low-income patients. And many of them are significantly more pronounced for metastatic patients. Of no surprise, at the top of the list is uncertainty about the future and being there for family and friends. But 7 out of 10 metastatic patients also say that they're concerned about managing ongoing side effects, 2/3 about the cost of medical care, and 6 out of 10 having the financial support you need. Drilling down on that financial piece, we also wanted to understand how some of these financial issues might change behaviors or lead to financial sacrifices. So we asked people, have you experienced any of the following as a result of your cancer? And you can see the list here. We asked about things like having to dip into your retirement savings, applying for government financial assistance, delaying a major life event or a major purchase, receiving help from a charitable organization, a grant, scholarship, even a GoFundMe campaign, 4 out of 10 of our national sample said they experienced at least one of these financial sacrifices. This jumps up to 73% among the people who are connected with NCCS. And again, those younger patients, Hispanic patients, low-income patients, metastatic patients, and those who are still in treatment are significantly more likely to say that they've experienced at least one of the items that I just mentioned. We just had 3% who said that they had a GoFundMe or similar campaign to help with medical and living costs, but that number jumps up to 12% for our younger cohort and to 10% among Hispanic patients. We asked a similar question to see how cancer diagnosis impacts people's work status. And again, we had 4 out of 10 who told us that they experienced at least one of the following issues on the page here: missing work, working fewer hours, having to take a leave of absence. We were happy to see that very few said that their supervisor or co-workers treated them badly because of their diagnosis. And again, you can see in the blue and bold that a lot of these issues are more pronounced among those same groups that I continue to talk about as we really think about disparities in quality of care. So I mentioned earlier that how supported people feel during their cancer journey really impacts how they feel about the quality of their care during treatment and after treatment. And in our qualitative interviews, when we ask people, what's the one piece of advice you would give to somebody who just receives a cancer diagnosis? That number one piece of advice consistently has been to find a good support system. You need a good support system to get through this, whether it's your immediate family, your care team, your friends, your faith, a patient advocacy organization, or some type of social media group. And we heard examples of all of these in qualitative interviews. You can see some of the quotes to the right where people talk a little bit about their support system. Family really tended to be the number one support system for the largest number of people. But we also heard people say things like this middle quote, oftentimes when you're dealing with family members, some of them don't cope well with the diagnosis. It's harder for my family than it is for me. So there's the need for these other groups to reach out to. When we ask people to describe the support that they've received during their cancer journey, again, we see the numbers dip. So just 53% describe their support as excellent. And there are, again, large gaps depending on demographics. So again, a big gap in age, also a big gap based on income. Those at the upper end of the income spectrum are much more likely to feel as if their support is excellent versus those at the lower end. We also see a gender gap. Men are significantly more likely to say that their support systems are excellent. We see a difference by stage of cancer, with metastatic patients less likely to feel as if their support has been excellent. And then again, we see a strong correlation between just care overall and how informed people feel about side effects. We went on to ask a few follow-up questions, and specifically with who is your kind of primary support system? And then we looked at that by how they feel about their support overall. So what was really interesting to see is that there's a big difference between those who feel as if they can rely on their family versus those who cannot. Among those who say that the main source of support is their immediate family, 62% describe their support as excellent, versus just among those whose main source of support is not their family, only 40% describe their support as excellent. And again, there are some interesting demographic differences. 18 to 39-year-olds, African-American, Hispanic, and low-income patients are less likely to feel as if they can rely on their family and more likely to rely on their care team and or their faith. So the next set of slides is around treatment during COVID. And we had in our national sample, about half of the people say that they've had a cancer care appointment during the pandemic. Almost everybody who's still in treatment said yes. I don't know about that other 8%. And interestingly, even though we know that cancer centers have had to make huge adjustments in protocols, patients for the most part have not noticed. 82% say that their care stayed the same during the pandemic as it was beforehand. 8% actually feels that their care was better, and 4% feels if their care was worse. Shelley, I don't know if there's anything you want to add here. I know this was something we talked about the last time we were on a call together.
Yeah, so we've shared this in a couple of settings, and what we know to be the case is that cancer centers did have to make a lot of changes to how they delivered cancer care to keep patients safe, particularly in the early days of the pandemic. I mean, it took some time to kind of work through all the protocols, and patients didn't always know that some of these changes were happening. So, I think we first saw this and say it didn't have a huge effect on cancer care. It really did have a big effect on cancer care, but maybe not necessarily their perceptions. We were really pleased to see that 90% said their care was the same or better, which is great because I know that doctors' offices, cancer centers, hospitals had to do a huge amount of work on the back end to try to keep patients safe. So maybe patients didn't necessarily see all of those things and maybe didn't always know what was changing about their treatment, but they assessed their quality to be the same or better. So we were grateful to see that.
Awesome, thank you. So this was also a great opportunity to learn a little bit more about telehealth and how people felt about telehealth visits. 4 out of 10 people who took the survey said that they had had an appointment via telehealth. And then when we went on to ask them what types of appointments they had, the most common was just follow-up appointments, 61%, and then the numbers really drop. For each of the different categories, we did ask a follow-up question, how would you rate the appointment? And you can see that for the most part, people felt as if the appointment was excellent or very good. Where we see the numbers a little bit weaker are around first visits with a healthcare provider, getting a second opinion, and physical therapy or rehab. And on this next slide, you can see to the left a patient talking about trying to do physical therapy via Zoom and how that was kind of difficult. We did ask people, thinking about the future when the pandemic is over, how would you prefer to do each of the following types of appointments: in person, virtually via telehealth, or don't you have a preference? And for the most part, people prefer appointments in person, particularly those with the first visit that they have with a provider, PT, a surgical consult, getting a second opinion, even regular well visits. Where they prefer telehealth or they don't really have a preference is on things like counseling and education, medication management, a survivorship appointment, and or sharing test results. And as we asked some open ends around this, and it's really, kind of all about convenience. We've now had the opportunity to do the survey twice during the pandemic. In 2020, we asked people how concerned they were about getting the coronavirus and the risk of getting the virus. 47% were very concerned, 38% somewhat concerned. The number who were very concerned dropped dramatically in May of this year when we conducted the survey. I'm just reminding people about the timeline because this was obviously before the Delta surge. 8 out of 10 people who took our survey had received one or both doses of the vaccine in May when we fielded the survey. Among those who had not yet gotten the vaccine, about a third said that they were likely to once their doctor gave them the thumbs up. 20% didn't know yet. And we had about half who said that they were not likely. And a follow-up question as to why, really just trust that the vaccine is safe, lack of trust that the vaccine is safe. And then I'll end the presentation with a small section around the word survivorship. So obviously the name of this organization is the National Coalition of Cancer Survivorship. We wanted to understand if this word resonates with people. So we asked, all of the people who took the survey, all who are either in treatment now, who have been diagnosed with cancer in the past, do you consider yourself a cancer survivor? With our national sample, 85% said yes. That number was even higher with our NCCS-connected sample. And comfort does increase over time. So for those who are in treatment right now, 63% said that they were comfortable with the moniker. That jumps up to 93% among those who were diagnosed 10 years ago or more. For the 5 to 7% who said that they weren't comfortable with the term, we did ask a follow-up question and ask them, why, and is there another word or phrase that describes you or that you would prefer? And for those who were uncomfortable, again, a small number, kind of 2 reasons. For some, they don't like the word survivorship because, as this person, this 39-year-old male says, it seems past tense. I don't feel like I'll ever be done with it. I'm going to manage it. I'm going to live with it. I'm going to keep getting tested. And then for other people, kind of the opposite, I like organizations that are not just about getting by, but about living your best life, and want the terminology that I use to emphasize living. So you can see the word cloud to the left. When we ask people, is there another word or phrase that describes you or you would prefer? Thriver, warrior, fighter, lucky. Those were some of the terms that came up. And then for those like that first quote, cancer patient. I'll kind of end my remarks with a couple of quotes on what being a cancer survivor means to you. From a 66-year-old woman, being a cancer survivor is like getting a second chance at life. It makes you feel differently about every decision you make. It also makes you feel incredibly lucky and gives you a new look on life. For another woman, being able to live my life peacefully, surrounded by my family. I feel that anyone that fights cancer is a survivor, whether they win or lose the battle. And I will end there. Stop sharing my screen. And Shelley, I know that there was quite a bit of chat and questions, so.
Yeah. We do have some questions. First, I just wanted to say on the identification with the word survivor, I think, this year we're celebrating 35 years since NCCS was founded by a group of people who got together and didn't want to be considered victims anymore and really coined the term survivor. And we're very intentional that it was from diagnosis through end of life. And we know that not everybody, and you shared some of the quotes, and not everybody identifies with it. But I think that the large percentage who do, including people who are still in treatment and people who have metastatic cancer, is a testament to how, over time, that's really become how we think about cancer survivor. And we welcome everybody to use whatever term best they feel comfortable with. But I think it's heartening to me to see that so many people, even still in treatment, because I know some people feel like they have to get through treatment before they count as a survivor. And that's never how NCCS has looked at it. And I'm glad to see that a lot of people that such a large percentage of people in the survey really understand that. So I have, please feel free to ask any questions in the Q&A. I know there's also some in the chat, but here are 2 questions that I'd like to pose to you, Pam, and I don't know if they're in any of the slides, but maybe you can just talk to them. So the question is, were we able to identify disparities in if the healthcare received, if it was more clinic-based for people of color versus white cancer patients? And I know we did look at where care was received. Can you talk a little bit about what we found, even though I know we weren't sharing those slides here? And were there differences for people of color in where they received their care?
I need to go back to the banners to look at that question. I do want to make one comment about that, though, a little bit unrelated, but an interesting sidebar. We know from our qualitative interviews that people don't always understand where they receive their care. So this year we asked people to tell us, did they receive it at a community hospital or cancer center? Did they receive it in an academic medical center? We even gave them a definition of what an academic medical center is, and then a variety of other options. And then we asked a follow-up question, tell us the name of the place where you received your care. And it is just fascinating how few, that so many people just don't know that they are actually going to an academic medical center. There's like a 10-point gap. I mean, we had our intern go through and code every single response. Liana, who works with me, is actually sending me the answers to that question. White patients were more likely than African Americans to say that they went to a community hospital or cancer center or to a private cancer center.
Okay.
But again, we also know that there are there's some confusion around where people are actually treated.
Okay. Yeah, I think, and I feel sorry for your intern who had to do that, but we knew that people don't always understand where, or they don't know the terms academic medical center either. And that's why we decided to do this sort of test to like ask where you were treated and then confirm. So thank you to your intern who did that. We appreciate it.
Yeah, and one of the panelists is saying that, some people are treated in more than one setting, and it was a multiple select. Yeah, so you could pick multiple answers.
And then the other part of this question was, do we know if patients presented at advanced stages, patients, people of color? And I know we asked about stage at diagnosis, but I don't recall seeing if there were differences. Do you remember?
Liana can look that up while we maybe take the next question.
Okay, great. Let me see.
So one of the questions is the data published or will it be published? And I don't know, Shelley, if you want to talk a little bit about that.
Yeah, we just, we shared all of this information on our website today. So if you go to, I think that the link has been posted in the chat a couple of times. It has the slides that Pam presented today. Plus we actually wrote a report with most of this data is in the report. And there's also some infographics that you can take a look at and share. So all of that is available on our website right now.
Yeah, and I'm just looking at what we call a crosstab, which is basically looking at stage by race and ethnicity, and there were no statistically significant differences. It was consistent.
Okay, that makes sense.
Shelley, can I ask you a question? I don't know if I've ever asked you this one before. You obviously are, talking to people who are really vested and all the time. What surprised you about the national data? Like when you look at this, where do you scratch your head and just kind of wonder?
Well, one of the things, and we've talked a little bit about this, is, I think one message that we have is like raise your expectations, because what I mean, you've said, and I listened to some of those in-depth interviews you all did. If people are alive, then they are happy with their care, even when the care they're describing is objectively not ideal. Which is why, we had asked before about how coordinated is your care. Very high numbers. That's why this year we added the question that asked, well, did you have to share information among providers? And high percentages of people who did, even though they said their care was coordinated. To me, coordinated care means you're not the one who's got the burden of sharing information among providers. We know that cancer patients do that. They talk to us about the binder that they carry around, or that they're the ones having to tell the different members of their care team what's going on. To me, that's not ideal coordination of care. But I think the gratitude that people feel towards their healthcare team that's helping them, even if the care is suboptimal, they're happy to be alive. And I think that's where, we saw those differences in how the NCCS-connected patients rated their care. I think their expectations are a little bit higher, and they're not as happy with their care because they expect more. And I guess, I'd like to see maybe if we could help others expect more out of their care as well, because I think, sometimes we're seeing care that's not the best, but people are just, so grateful to be alive that they sort of accept it.
So there is one comment, and I want to apologize for maybe misusing terminology. Somebody said that they cringed every time the slides have said metastatic patient. And that, Shelley, you've used person-centered language like people with metastatic cancer. So I will correct that on the next version of the report. Thank you for that.
Yeah, that's a good point. And we did have a big focus on that in this report, trying to understand where are the differences. And I mean, I think I can't say I was surprised by most of what we saw there. It was to be expected. I think a lot of the things, the higher symptom burden, the higher burden of the physical and emotional. And I think, one of the things we saw this year that was consistent with all 3 years is the management of side effects are much better for the physical side effects that are easier to treat, that we know how to treat. And where patients don't feel like they're getting as much help is things like cognitive issues, the fatigue, the psychosocial issues that aren't as easy to treat, or that I think, oncologists often feel like that's not necessarily where they can be the most help, but it's somebody else who needs to do that. And I think we struggle with enough mental health support for people. I think that the needs of mental health have gone up dramatically over the last couple of years with the pandemic. And I think that also adds to the kind of burden on the system to make sure that people get the psychosocial support that they need.
So there's a couple of questions, Shelley, that look like they're more for you than for the survey researcher. What are patients getting for post-treatment planning now that the requirements for survivorship care plans has been dropped?
Did we have a number, what percentage of people had received a survivorship care plan? I remember last year it was less than 20%, a little bit higher for the NCCS-connected.
Yeah, this year among the national sample, we had 20% who said that they discussed a post-treatment survivorship care plan with their healthcare provider.
Mm-hmm.
So
yeah, I mean, with the requirement dropped, I think the focus is more on overall survivorship care than a specific plan. And we still believe that a plan is really important, and that's why we're still working on that on a public policy level to try to make sure that that is something that's reimbursed so that more patients can receive that, because I think, it is really important. And the satisfaction with post-treatment care showed that people aren't necessarily getting that help. I was a little dismayed by how few of those topics that are really important to people are being discussed in the post-treatment appointments. And I think a care plan would help facilitate that and be something that could be updated throughout, the course of someone's post-treatment survivorship care. So that's disappointing. I'm not sure we can say that, the numbers have gone down in terms of people receiving them with the removal of that requirement by the Commission on Cancer. But I think that that's probably likely to happen, but it doesn't look like we can say that for sure with the data that we have.
Another question that came up was how should those of us working with young adult patients, given the findings around this, use this information? Just, I don't know if you have any thoughts about that, Shelley.
Well, I mean, and also there was the question of why the survivors in the 18 to 39 was a consistent disparity. I think there's a lot of reasons for that. I think part of it is so many of the ways that care is designed is around the fact that more than half of cancer patients are over 65, or about half are over 65. So that's sort of how the system is designed. Also, the older patients over 65 have Medicare, which helps with, and some under 65, but that helps with the financial burden, that the younger patients don't have that. I think it's also just such a critical time in their lives when they're, starting families and earlier in their careers and maybe don't have as good of a support system. So I think that it just highlights the increased need for support for those patients. And there's some wonderful groups that are working on that, and we're partnering with them on a number of different things that to try to help both on a policy level, but also on an educational level of what young adult survivors need, because it was really consistent disparity. I would like to ask you a question, Pam, because one of the things we talked a lot about, the groups that had the consistent disparities in their responses were the young adults, women, Hispanic, Latino. We didn't see Black patients show up in that as often. I mean, there were some areas where Black patients had a statistically significant difference. Why do you think that is, or where were there areas where the Black patients did have a statistically significant difference? And it just, it almost, when we went through this data, it almost looks like we're not focusing as much on that, but really it's because the data didn't show as much of a difference as we saw with the Hispanic and Latino patients.
Yeah, I mean, there are a couple of areas they did not stand out as much. I mean, part of it, again, I think part of it is about where there are some demographic overlap as well. So we tended to have younger Hispanic patients who took this survey. So there was just like a conflation there, and older African-American patients who took the survey. So that is part of it. But some of the places where we saw differences, one major one was just overall how they describe the treatment and care that they receive. There is there's a big gap between white respondents and Black respondents in terms of the percentage who say that their care was excellent, an 8-point difference there. The other place that we saw a big difference was around support systems. African-American patients less likely to say that they could count on their family members as a support system, more likely to say that they went to their faith for support. So those were kind of two big places where there were differences. But it wasn't because we didn't look for those differences, just because they weren't significant.
Yeah. Okay. That's what I thought was really important to note, just because it looks like we were intentionally focusing on Hispanic Latino patients. It's just that's where we saw the most differences, and it's statistically significant, which is a really hard phrase for me to say, but I just said it really well that time. I didn't mess it up. I
have a problem too, and I have to say it like 10 times every day, Shelley. So.
So there's a question: how will this information be used to improve care for cancer survivors? First of all, I mean, we're just grateful to have this data, and to have, I think, the fact that last year we added that the component of having that national sample really makes a huge difference, because we did see such big differences in some areas between the connected patients and the national sample. And I think it's just a reminder that the patients that we work with and the advocates that we work with are not necessarily representative of all cancer survivors. So having that data allows us to share it with so many different sources. I've actually we did this survey in May. We shared it with our advocates at our symposium, our CPAT symposium in June. And I've shared it already in a number of different settings, including the National Cancer Policy Forum, where I was able to share about patient perceptions during COVID. So and we've used this in some of our comment letters that we submit to CMS and other government agencies. So we really use it in our advocacy efforts with Capitol Hill, with federal agencies, with healthcare providers, and we will continue sharing this. I end up presenting this data many times during the year, different slicing and dicing of the data based on the group that I'm talking with and what they're interested in. But it does help us understand what the needs are and where we need to focus our policy efforts and our educational efforts. And we love to share it with different groups. We also, one of the things that EDGE built for us was a dashboard that lets us look at the data in different ways easily, so that I don't have to just email Pam and her team and say, someone asked me about, the data for X, can you help me? I can actually go look at it myself in this dashboard. So it allows us to look at it in different ways. So the first take of it and what we're sharing with you all today is sort of the big picture of the data, but there are, we can go back and look at the data in different ways and answer questions that come up. So we use it to really inform all of our advocacy efforts, and we're happy to share it with different groups when they're interested in learning more. That we're grateful for that. There was a question, do we have it broken down by cancer type? And we do ask cancer type. I don't know that Pam, do we have enough of the different cancer types to really compare? I think in some cases you end up with small numbers, right?
Yeah, I mean, the two biggest groups are those with breast cancer and prostate cancer. So those are, that's almost half the sample. I mean, some people have had multiple types of cancer. Your dashboard will allow you to do that, though, Shelley. You can click on whatever you want and look at the numbers. In some cases, the data will be directional.
Great.
So I'm looking at the last few comments, and they're mostly just shout outs to NCCS for its leadership and for providing this information.
Well, I want to thank you, Pam, and your team for being wonderful partners in this. And again, thanks to Bristol Myers Squibb for supporting this research. And thanks to all of you for attending today. Every time we do this, we get ideas for more questions to ask next year. So some of the questions you all asked, did we ask about this or did we ask about that? We didn't, but we will next year. Every time the survey gets longer and longer, and Pam says, this is getting really long. And I'm like, yes, but I need to know all of these questions. So fortunately, I think people actually really like to complete it, because even though it was long, we did get people asking, people responding. And I think, I remember listening to some of the interviews where they were just really grateful that someone was asking these questions about their experience and being able to share that information. So we're trying to keep the survey from getting too long, but we do keep adding every year more questions, because when we present it, you all ask us questions that make us want to learn more about another topic. So we look forward to asking additional questions next year. Thank you all for joining us. Thank you so much to the EDGE and NCCS teams for putting all of this together. We really appreciate you joining us today, and look forward to sharing this information. And let us know if you have data needs that we can help you with. Thank you.